Okay, so I think we are live again. I'm sorry, everybody. We just had a technical problem, so we will continue with Paulo. Thank you for waiting.
So, what were we discussing? So, in the Spaying part, I was saying that what I normally advise colleagues is that we should look at the animal, at the female at this point, from an individual point of view. So we should really do these consultations because we have been forgetting to make them in the last perhaps 5 to 10 years. In my experience, it's just a systematic approach, and I think this systematic approach is not the correct for the patient itself, and we should look at it individually. So when we look at spaying of a female, we should look at several things. First of all, we should look at the breed, if there's a breed. If not, we should look at the size of the animal. And then we should look at the likelihood of developing autoimmune diseases. Of course, the aesthetic issue, but that's less important for me at least. Presence or development of neoplasias. Weight gain, this is very, very frequent, especially in some breeds. If the dog is already obese, we should not spay it. Or if a dog has prevalence of obesity, we should really consider having a nutritional approach before spaying it. But this most of us do correctly. Genital disease, it's very frequent for me to receive female dogs spayed before 6 months of age, and then they will develop what we call the vulvar entropion, and then vaginitis, chronic vaginitis for all their lives, all during their lives. And then, last but not the least, orthopedic affections. We know that the age of spaying could and can most probably affect development of osteoarticular disease. Oh, where's my mouse? Here. So, some articles, again, from 2013, Hoffman, with 70,000 animals, he looked at the breed. And back then, this was almost 10 years ago, some breeds really have a high likelihood of developing immune-mediated or neoplastic diseases. Lhasa apsos, for example, Scottish Terriers, and then other ones like the Yorkshire Terrier or even medium poodle, do not. So look at the breed. So what are the arguments to spay in real life? We know what we all use, mammary tumors. Of course, we know this very old article that's totally up to date. However, if you look at the percentage of animals dying from mammary tumors, you will see that it is rather low if diagnosed precociously, also early. But to use mammary tumors as an excuse to spay an animal, if we will develop other conditions, we should take this into account. The same for pyometra. Nowadays, most animals do not die from pyometra. First of all, the incidence of development of pyometra will vary between breeds, of course, but let's say more or less between 3 and 15%. In some breeds, a little bit more, but most of them will have an incidence of 3 to 5%. So then again, is an animal dying from pyometra? What's the mortality rate of pyometra? A very interesting article from Canada, from White, will tell us that today, very, very few animals die of pyometra. And then again, pyometra occurs after 5 years of age. In most cases, of course, an animal with 2 can also develop a pyometra. So if it is at 5 years of age that you will have a pyometra, she will have a pyometra, why are we spaying this dog at 6 months or at 10 months? So let's look at other things. Ovarian and uterine tumors, very rare. So also not an argument enough to decide for itself. Then the runaways and unwanted behavior, I would say this is probably one of the most important things that we have to look at. So we have to look at the individual and the lifestyle of the owner as well. There's this very interesting article from Heart to 2020, so 2020, and it's under construction article, let's say. So it is an article that will help you, and I give this to all my students and my colleagues. It is an article that will allow us to decide. It will help us to decide whether we should or not spay an animal. This article looked especially at three things: osteoarticular diseases, tumors, and urinary incontinence. And so what Hart brought us was, for example, let's look at the example of a border collie. The border collie comes to consultation at 6-8 months, and the owner says, yeah, I heard that spaying is good for my animal. It doesn't develop any mammary tumors, blah, 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 the story that we all know. The thing is that regarding this breed in particular, it is advised to spay beyond 11 months of age. And we should look as well at the heat cycle, because if it did not have a heat cycle before, we should wait till it has a heat cycle, because we know that it will help develop the vulva and then the genitalia, the external genitalia. If you look at other breeds, for example, Cocker Spaniel beyond 23 months, Labrador Retriever beyond 11 months, Golden Retriever females should not be spayed according to this article. Then again, this article in some breeds, that's why it's under construction, doesn't have a very, very, very large population. So you will have this table, which is interesting. However, then each breed is carefully described, and they will justify why did they categorize it in the category that they put. But data is still missing, that's for sure, and it will be hopefully updated every 2 years, 3 years, 4 years with a bigger number of animals. But that's the path we're going through. In many conditions, we are looking at the breeds in particular, and we see that the genotype of that breed will influence the outcome, pathology-related conditions. So, in a conclusion form, we have to understand the owner situation. So we have to perform a real consultation for the spaying procedure, which is, of course, a conventional procedure, but nevertheless, it is a very important procedure that will possibly condition the rest of the life of that animal. Surgical castration is not always the best option. Behavioral issues, for example, in males, really should be careful on castrating a male dog, for example. Side effects will depend on the race as well as on the spaying age. It's not about spaying or not spaying. It's when to spay. This is my main point of today. It's not spaying or not spaying. It is when should we spay or not spay. Okay? So what we should do in the future is that we should approach each patient as an individual patient. And this is the message that I would like to especially pass today.
Thank you, Paulo. This was great. I really learned a lot. I'm still the old-fashioned colleague that thinks about the mammary tumor and it has to be castrated. So it was really enlightening. Thank you so much for being here with us today. And I hope everybody enjoyed also, and hope to see you next time in our webinars. Thank you, Paulo. Have a lovely evening.